Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, we had a program, maybe a couple of years ago about issues related to prevention and wellness and nutrition. And we have a lot of calls recently. I think because so many people that are out there, so many of our viewers are looking for ways to not only stay well and have a quality of life, but also to prevent a lot of the illnesses that are prevailing upon us as a population. So the title of this program is Prevention, Nutrition, Wellness, and we're also going to talk about vaccines, adult vaccines. So let me introduce to you our guests. Sitting in front of me is Dr. Marilyn Gordon. She's a well-known expert in the area of nutrition and other elements relative to prevention. And to my left is Dr. Jill Wallace-Ross, who is a physician, a primary care family physician, but is an expert in wellness and prevention and what I would call collaborative medicine. How about that?
That sounds wonderful. Thank you so much for having us, Dr.
Thank you. I'm going to start with you, Dr. Wallace-Ross. Talk to us about just generally what we have. We have a wellness and prevention clinic here at Nova Southeastern University, and many of our employees, many of our, I guess you could say, patient population, utilize that as their center, their sun in the universe.
So yes, here at Nova Southeastern University, we have the NSU Employee Health and Wellness Center. It has been open for several years now, and we have really seen a lot of success in managing both the acute illnesses of NSU employees, their partners or spouses, and their adult children, as well as the prevention side of things. In employee health and wellness, the mornings we have for acute illnesses traditionally, and in the afternoons is when we do our routine maintenance and our preventive visits. And what we've found over the past several years is that people will come in for an acute illness, have a good experience with us, and when we tell them about our preventive services of doing annual exams, doing a lot of the screening tests as we age that are gender dependent and age dependent, they realize that this is a great place for them to go for their care. All of the doctors there are very knowledgeable. We keep up to date on all of the newest changes in terms of immunization recommendations, changes to screening guidelines for different types of cancers or age-related illnesses. And we try to provide comprehensive health within our center. When there are other things that we may need, like nutritional support, we certainly refer to Dr. Gordon and other healthcare professionals here at NSU, like optometry, physical therapy, occupational therapy, and whatever else the patient might need individually.
You know, I know that I'm going to ask you a question, and the list really is pages, but maybe we could sort of hit some highlights.
Sure.
With reference to the prevention issue,
yes,
screenings are so important. Maybe we could put up some of the, I know you're not going to be able to do all of them, but give us some highlights as to what these folks out here really talk to us all the time with their messages about, you know, I just want to be a little bit more like I used to be. I want to do some things. And so, you know, we always tell them that you have to take good care of yourself. I tell them that at the end of every show. And taking good care of yourself is really preventing some of the problems that restricts them. So let's talk about some of the screenings.
Sure. So there's a number of screenings that patients may go through depending on their age and depending on their gender. So taking a look at the female patient, two of the big things that people think about in terms of the female are cervical cancer and breast cancer. So the screening guidelines are actually very interesting because the guidelines per the different organizations, there are some differences and they're constantly updating and reviewing the guidelines. In terms of cervical cancer screening, when I was trained, you did a pap smear every single year. Now the recommendation is in the 21 to 29 age range that you test every 3 years, and starting at age 30 till about 65, that's when you can do every 3 years or you can go every 5 years if that pap smear includes a test for the human papillomavirus. those screenings are certainly important because catching something early on can actually prevent it from being an invasive type of cancer that would need something further on down the road. In terms of mammography, there's a lot of debate about that too. I looked at 3 different organizations, the ACOG, American College of Obstetricians and Gynecologists, and they had recommendations. The United States Preventive Services Task Force had recommendations, and then the American Cancer Society had recommendations. Basically what it comes down to is health insurers are still going to cover mammograms starting in the 40-year-old range, but the most patients that benefit are those women between the ages of 50 and 64. So that's the peak time for breast cancer to develop. So a lot of the recommendations focus on screening during that time every 2 years. Some screening guidelines go into older age, some go younger depending on their individual life histories and also the life expectancy of that female patient. Then we think about the male patient, and the one that always comes up is PSA. There's a lot of debate about whether or not we should check a PSA, which is a prostate-specific antigen in males as a predictor of cancer. Now, the research actually shows that the benefits don't necessarily outweigh the risks, and what they recommend is a detailed conversation with your individual provider based on your needs. There are a lot of risks if you have a false positive on a PSA, including unnecessary procedures that could lead to impotence and erectile dysfunction, urinary issues, so there's a lot of discussion to be had there. One of the other big screenings that we look at is colon cancer screening. The typical average time of screening is ages 50 to 75 every 10 years, unless there's some kind of something that is found during a prior colonoscopy. Then you would want to look a little bit more closely. In the African American population, we usually start recommending colonoscopies at age 45, and if you have a history of colon cancer in your family, a first-degree relative, you're going to be starting earlier than when they even were diagnosed.
That's great. I'm glad. Thank you very much. Dr. Gordon, you're a diamond in the middle of a whole group of gems that we have here, because I know of your dedication in the field of nutrition and prevention. So let's tell the folks what Dr. Marilyn Gordon does.
Okay, well, I'm lucky to be housed actually in our employee wellness suite. So I'm up there with the physicians. Sometimes the physicians will come from talking with their patient and actually bring them right into the office just for an introduction, so they feel comfortable to come back for some nutrition counseling. So we're finding prevention with nutrition is key. And just recently, for an example, there's an employee that's also a patient that has very high cholesterol levels that wants to try to manage it without medication. So the physician, we actually had an introduction, but they want to try a plant-based diet, more of a vegetarian diet, lifestyle, proactively, preventively. It'll be on trial basis. They'll redo lab values after these changes. And so that's an example of, prevention going, with food first and then later medication if necessary. And so I feel fortunate to be in that environment where the physicians value nutrition because it is a very important piece. And you mentioned also cardiovascular health. So of course, our food has a lot to do with atherosclerosis, our blood pressure, and things like that. So food is very valuable. And so a lot of times people really need an individualized education, more personalized nutrition. And we're going, if you look to the future, we're really going toward that track. So very much personalized nutrition. So why doesn't everyone need, let's say, a low cholesterol diet or a low saturated fat diet? Because genetically we have some differences and we're moving in that direction. And also we know our food components can actually alter the expression of genes. So let's say I have a history, my family has a history of a certain type of cancer. I might be able to modify my diet to modify my genes. And this is where the future is going to be in nutrition. And we have a lot of dietitians physicians that are practicing in that realm right now. So I find that exciting for the future.
Well, you know, the words that I have not brought to this conversation is integrative medicine. And really, I was waiting for you to tell us what you do, because really, that's what collaborative, integrative medicine is all about. I believe that our great medical community that's out there is starting to see the value of not only collaboration, interdisciplinary collaboration, I'm talking about medical techniques and medical presentations, but also the involvement of what I would call outside of the general realm that they've been taught, of integrating into their presentation of services things like nutrition. Dr. Gordon, let me just touch on something and then we'll get on, because I know the whole show could be about this subject. Obesity is, I mean, it's endemic in our country. It's really sad, because I see it in young people that, and I think, I mean, again, my educated guess says that for the first time in the history of statistics in this country, we have a generation that potentially won't have a greater lifespan than the lifespan of us that are sitting here today. And everything says, and I'm not the health professionals that you are, everything says to me that it has a lot to do with two factors, one of which is the wellness and prevention, quality of life issues, but on the other hand, it's that big issue of nutrition. What are we eating? What does the body respond to? So I'm going to throw it your way, because we had a conversation about this. It could be a whole program, but I'm not. We can't.
It certainly could. And I would say, if we look far into the future, it starts today with prevention, which now we're talking prenatally. So really, actually, before conception, that conversation needs to begin, because it's throughout the prenatal period, in the early years for youngsters. Again, they're mimicking their parents. So the foods they see their parents eat, the situations that they eat, do they eat at the table? Are they eating in the car? Are they eating on the run? Or are they eating relaxed around a dinner table? Is going to have a lot to do with what later happens in terms of a healthy body weight. Activity, you know, if the family is active, the parents are active, again, they're watching. Sometimes they don't listen, but they're watching. And so we really have to think preventively and be proactive, because once we've gained the weight, so anyone that has gained excess body fat knows it's not easy to take it off and keep it off. So we have many fad diets out there, more every day, but they're not working because they don't work, because they're a fad, they're not about a lifestyle. And again, in our wellness clinic, we're looking at the lifestyle. And I know this, that our physicians talk to them about, you know, again, food, activity, stress management. Really, we try to approach it from every aspect. And so we can, if we can't provide the service, we're referring them to someone that can, because that's the only way to reverse obesity, is really the lifestyle. You know, what is the barrier? And addressing that. You know, so prevention is one thing, and we can start today for the children and the adults of the future. If we have currently the excess weight, it's really finding healthcare practitioners that are working integratively, as you mentioned, to come together and help them solve. It's a health crisis. It really is.
It's a major health crisis. Dr. Wallace-Ross, again, you end up seeing this because you see the point in time when the crisis is about to present medical, not only life risk, but potential medical disaster. So let's talk a bit about that.
Sure. So when a patient comes in to be seen that hasn't been seen by a physician in a long time, typically is what happens when we find out that they have certain issues. So if somebody hasn't been to the doctor in a while, they don't know that their blood pressure is high. They haven't had their cholesterol checked, so they don't know that they're increasing their risk for heart attack and stroke. They don't know that their blood sugar is elevated, and they may either be pre-diabetic or diabetic and have no idea. So when we encounter individuals who have health issues as related to obesity, we try to explain to them the consequences and the sequelae of those illnesses and educate them about them. But we try to take the holistic approach that Dr. Gordon is talking about by trying to figure out what the barriers are to doing the things that they know they should be doing. Oftentimes patients will be hard on themselves. I know what to do, I don't have the willpower to do it. I don't have this to do it. In those kinds of conversations, I try to break it down for them and say, tell me one thing you want to change. One thing we can change together, whether it's walking 5 minutes per day, taking the dog out for a little bit longer walk around the corner, running around with the children, changing one food item in their diet. I try to get them to commit to one change and to follow that one change for a period of time, say 1 to 2 months. I think giving them the opportunity to change one thing as opposed to changing everything in their life at once is a lot more palatable and a lot more feasible and doable. And over that time, you develop that relationship of let's try this, but report back to me how you're doing. So as a physician, we're not being critical of any issues that they have in actually trying to reach that goal. We just try to take it from we're a human being trying to help you to get to where you want to be, so let's go a little bit slower. I think it can be very overwhelming for a person to hear they have high blood pressure, high cholesterol, diabetes, when they've been going around for 10 years thinking they're perfectly healthy. It's a lot to digest, and I think that the way that we approach the patients is very important. It needs to be done with a delicate touch.
The last time you were on this show, we spoke about reading labels, going into the supermarket and turning that package over and reading what's there. But you know, the labels have changed dramatically since the last time that you and I had this conversation, because now all of a sudden you're starting to see, whether it's for marketing purposes, and I would say no, it's for good purposes. You'll see non-GMO products. You find the issues relative to no antibiotic feedings, et cetera, et cetera, et cetera. They may sound like oversimplistic things, but they're major relative to the ability of these people to stay healthy. How about that, Dr. Gordon?
Yeah, so actually by law, the label should be changed by February 2018.
Right.
One of the most significant things, besides it getting a little larger so we can read it, is added sugars. So this is the first time ever that by law they have to put on the label how much of that total carbohydrate is actually added sugar. And that's important because, again, diabetes, but even in cardiovascular disease, all those extra sugars are pro-inflammatory. So now we really can kind of decide, which carbs naturally occurring in nature, but which one was added sugar, and help us make better choices. So food labels are being improved, and they're very important. And for those that are interested, again, in non-GMO, organic, those are on the label as well. And the other thing is food sensitivities and allergies. All those things like gluten-free, nut-free, dairy-free need to be on the label. So very important piece of nutrition information.
Well, like I said, since our last time that we were together, I've noticed it is dramatic. To me it is, because you made me cognizant of the fact, although I don't do the shopping in the family, I shouldn't say this, I have a wonderful partner, wife, friend, whatever you want to give her name to be, but she's a very, very due diligent shopper, and we talk about it all the time, It's simple little thing like, I'm a milk drinker, so a very simple thing. By picking it out, I know right away that there's been changes. To me, it's amazing, because you were a voice that somehow told me, although that I brought it up to hear it from you, but it's happening. which is to me, it's very exciting. Let's go on to the issue of adult vaccines.
Yes, so adult vaccines are very important in helping to prevent certain illnesses, especially some in all adults, but also especially in certain populations of adults. For generically, the recommendation is that all adults get a flu vaccine starting for the flu season, typically starting in October through March. Different locations will see flu come in a little bit earlier. But it is recommended that all adults get a flu vaccine. One of the other vaccines that has really come up in the public eye in, I would say, the last 10 years is the Tdap vaccine. That's tetanus, diphtheria, and acellular pertussis. What happens is we as children typically get immunized against the pertussis when we're little, but as we age, that protection wanes. So we recommend that every adult gets at least one Tdap instead of their just tetanus booster, and then from then on, every 10 years have a tetanus booster. It's especially important in pregnant women that during each pregnancy, regardless of the timing between the pregnancies, to have the Tdap. And the reason for that is because it's the young children that don't have their full immunizations that are at risk of death from pertussis if they catch it. So if we as adults catch pertussis, we might have some issues, we might be sick, but the kids with their small airways, they can't really survive. So we immunize the adults to try to save and protect the young ones. Another vaccine, especially in the older adult population, is the shingles vaccine. This is a very interesting vaccine because it's effective in preventing shingles about 51%, but the more important thing is that it prevents postherpetic neuralgia, which is the pain syndrome that can follow an outbreak of the shingles zoster rash. And that is, the vaccine protects it 64% of the time. So it's actually more protective from postherpetic neuralgia than it is actually against getting shingles. But it's still very important because that pain syndrome can be hard to live with. Another vaccine that is encouraged for older adults is the pneumococcal vaccine, typically starting at age 65. Is a pneumococcal vaccine. Pneumonia in older adults is very hard to get over, even with antibiotics, just because our cardiorespiratory systems are just kind of slowing down and we're not quite as effective at moving air, so our lungs tend to take the brunt of it and keep onto the infection. So for adults, I would recommend flu vaccines, a Tdap at least once, the pneumonia vaccine, and the other ones would be really dependent upon specific health issues.
How often is a pneumonia vaccine required?
It depends on which vaccine that you're using, because there are a few of them out there. So it could be just a one-time shot, or it could be two. It also depends on different health conditions. For instance, people who don't have a spleen, for instance, usually need two immunizations, but traditionally it's just one. It just depends on which exact vaccine was used. So one or two, depending on age of start and which vaccine was used. There have been new pneumonia vaccines that have come up, which is why I'm saying that, because one of them only has certain components and the newer one has more components. So it depends on what had been done, typically starting at either age 60 or 65.
Okay. Well, we're down to the last 2 minutes of the show. So, Dr. Marilyn Gordon, I'm going to give you an opportunity to give us your best words in 1 minute, and we're going to Joe Wallace Ross right afterward.
All right, maybe there's 3 things to remember as far as for good health and good nutrition. Eat more vegetables, eat foods in their natural state. I would definitely go with the hydration, as the cardiologist mentioned. Physical activity, which can be exercise or it can be gentle movement. Maybe keeping stress low, because a lot of times people will overeat in response to stress. It has nothing to do with hunger. So maybe practicing yoga, meditation, Tai Chi, or a nice little walk around Gold Circle Lake.
That's very good. Thank you. And I could tell you that you mentioned at the time that you were here before, how important hydration is. And when you say hydration, you really mean water and non-sugar items.
Water should be the majority of what we drink.
Right. Okay, thanks. Dr. Joe Wallace Ross, I know that's very difficult in 1 minute, but tell us.
Well, I agree with what Dr. Gordon was saying. Movement of any kind, whether it's just going up an extra flight of stairs and using the bathroom and a flight up just to get a couple more steps in. Getting good sleep is also really important, making sure that 7 to 9 hours of sleep is what adults really need in order to have their cognitive functions and their health and their metabolism. So making sure you get enough sleep, eating well, definitely fresh fruits and vegetables, hydration I absolutely agree with, and decreasing your stress in however way you can.
Well, we certainly, and you certainly know this because being married to one of the most wonderful people that I know my whole life, by her forceful advocacy, we redid the stairwells at the Terry Building to invite people up and down the stairs, yes, rather than taking the elevators. So, folks, I hope that we brought some attention to prevention, wellness, nutrition, and particularly adult vaccines. I think you ought to pay attention to all of the crises that a flu epidemic can bring into your community. Talk to your doctors and talk about the pneumonia or pneumococcal vaccine. And remember, there's a big difference between the children and adult vaccines, so get that out of your mind, and let's do something to take care of yourself. So one more time, I say to you, remember this show is called Dateline Health. If you have any questions, you have any comments, just there's an email address and telephone number right here. And as I always tell you, take good care of yourself. You got people that would want to take good care of you. So take good care of yourself, and remember, my name is Fred Lipman, and this show comes to you from Nova Southeastern University. Until next time, see ya.